Bata-bata, paano ka ginawa? Ako po si Angel Rivero at kasama ko ngayon si Dr. Virgilio Novero. And syempre, ang kanyang proud patients who are a success story, Miss Lemon and Mr. Val Lorenzo. Thank you everyone for consenting to be interviewed today. So, Ma'am Lemon, I'll ask you first. At what point did you decide na, nako, I think it's time to see a doctor, a fertility doctor in particular?
It took me, because we've been married for 6 years, right? So on the third year, for the first 3 years, we're doing it a natural process. It did not push or anything. So third year after, we tried to seek a doctor, not really an expert, but just an OB-GYN. And we tried to have everything work up. And then we tried 3 IUIs during that time. And then we've been referred to Dr. Novero eventually after.
I see. So, Dr. Novero, when sila Ma'am Lemon came to you, at what point in the whole process were they na?
Yeah, because on when I saw them, I realized that they were a case of unexplained infertility, and when you follow the protocol for this particular disorder, you're supposed to do certain parts of the process, and they were already quite well. They were getting along. So after 3 failures of IUI, and it was done by a creditable doctor, then they were already qualified for in vitro.
I see. So, that means, Madam, you went for in vitro na. I see. Was it an easy decision para sa inyong mag-asawa?
For now, it's no, because we have to prepare our emotionally and financially, because we know that we heard that we have to be prepared how much money that you have to pull in, and of course, the body of my wife, you have to be prepared how she will be taking on the IVF. But then, of course, with my support and also the family support, we go all through the way to go on the IVF.
I see. Ma'am Lemon, as you were trying the different treatments, did you feel any different during this process? Or parang wala lang, it was just normal and you were just taking medicine and stuff like that?
At first, you'll feel pressured Kasi the expectations is, once I've gone the IVF, I'm expecting first try, dapat successful na. And I also need to prepare myself because I've been polycystic since I'm college. Then, according to them, in order for everything to get you pregnant, you need to lose weight. So during the time that I'm undergoing IVF, I'm trying to lose weight. I had my own personal gym trainer
Wow!
just to make sure na I'm on track and my body's prepared for the procedure.
Oh, but you sound like you were very determined then.
Yes, but it's been what, 6 years.
Right.
Waiting.
I
And
see.
everyone is expecting you should have baby on your first year or your second year. And I'm the youngest. He's also the youngest in his family. So they're just waiting. When are you going to get pregnant? When we're going to have her?
It's like a family thing in the Filipino society that whenever there's a reunion, when you're having a baby, every reunion, every Christmas, they're saying when I'm getting a grandson or granddaughter.
Nakakainis yan.
Yes. It's just before when they're going to get married. Now we're past that. Now they're asking.
Yun naman
where
yung
they're getting-
susunod.
Yes. So the pressure's there, but the support of the family is there as well. So both of us were really determined to have that procedure done.
I see. So, Doc, when they came to you and then they sought IVF na finally, how do you determine whether a patient is a good candidate for IVF?
Yeah, we do some workups, general condition of the patient, her weight, her comorbidities, meaning if she has other problems like diabetes, hypertension, all those things you have to consider. And then we do basic evaluation in terms of what medications you would probably require,
I see.
and the risks of giving her certain doses of the medications in IVF. So all those were considered.
Was the first IVF successful?
It was not, because had some she had some, to a certain degree, of polycystic ovary. So reviewing that, there may have been some problems in her implantation. So I had to seek the help of another friend, colleague of mine, an immunologist, to help them get over that hump, so that in the second try we were able to get it.
I see. Para sa inyo po bang mag-asawa, after the first IVF not succeeding, was it immediately, no, we're going to try again? Or was it something that you really had to meditate on to make the decision to go a second time?
Yung first na failed, we're really devastated. We're really even crying at doctor's office kasi we're really expecting parang the embryos are cream of the crop. That's the term we're having eh. So, we're crying on with this Dr. Novero. We're very frustrated kasi it's not, hindi naman biro yung the money that you have already spent for that and the time that you've been preparing. But then, we talk about it and we decided, ando na kami eh. So what's the point of giving up? Then we, a week after or two, we went back to Dr. Novero, let's try again.
Ganun kabilis ha? Parang, no, we're going to try again.
Yes.
Yeah. And Doc, for your patients, like in your experience, for similar cases, is it typical for a patient like this to really try second time, third time?
Yeah, well, there are certain patients who have a lot of expectations the first time. So if they fail, then you are supposed to check what are the possible reasons why they failed. In their case, it was quite clear that they were get good prognosis, and if they fail, there will be just a few things that we needed to check. And when we found it, then we just had to go that way. We normally don't go that way the first time because it's not a common problem. But if it fails, then that's the time that you do it, and that's what happened with them.
Wow. That's really cool. What do you think, Doc, are the advantages that worked in the favor of Mr. Val and Miss Lemon?
Well, they consulted young. That's very good. If they consulted me much later, then their chances would be much lower. So that gives them a boost.
I see. So it's really time sensitive. We can't deny that.
That's right.
I see. Now, do you have any advice to give to couples out there who have also been trying, who are also feeling frustrated, but have not yet quite decided how they're going to go about it?
You first.
Yeah, I think it's more of you have to decide whether or not you want to build a family first. I said it to Lemon last night, that family is not as important, but it's everything.
We saw that one in the billboard.
Yeah. So, what it is us if we don't have a kid and we care about our body, and this is something that you put on the legacy in your future. So by then we decided that even though we have to check whether or not we're getting pregnant or whatsoever. So I said to her, let's do this. Let's work on this, and let's support each other. So we have the backing of our family,
That's
friends.
amazing.
Yeah, that's push us further.
Yeah. We're both workaholic. So basically the expectations is if you're really that determined to have a family, there are more or less sacrifices on different aspects of your life. And then especially you need prayers. It's
Yes.
it's something that you shouldn't forget every now and then, right?
Yes.
But I think for everyone, if you're really determined to have something, regardless of whatever you're doing, just have to put your mind and your heart in it. And you need the support of your family.
Awesome. How much longer before the baby is ready?
Doc, I'm 34 weeks now.
Pretty soon.
Pretty soon.
She'll be coming
Pretty
along pretty
soon.
soon.
We have some really excited parents here. Doc, para sa inyo naman, what piece of advice can you give to our viewers who are currently in that crisis where they feel like, oh, maybe I have infertility issues, what should I do, and maybe how they should go about it?
Yeah, she said it right. When you think you're not getting pregnant or when you're not achieving your dream of having a child, consult as soon as possible. The earlier that you consult, the younger you are, the higher your chances, especially if you're over 35.
I see.
That makes it a lot harder for the patient and us, for us doctors also to treat them. And for those who are thinking about having a family when they're much older, meaning they're putting their career or whatever ahead of that, think twice, because having a child after age 35 can be much more difficult. Well, there's egg freezing now, but
Yes.
it's still much more difficult compared to having your child the natural way.
Since you mentioned egg freezing, Doc, what are the chances of a successful pregnancy based on using those frozen eggs?
Right now, it's hypothetical based on the presumption that the wife would be marrying a husband who has normal sperm.
Yes.
So that's only half the equation. But assuming that, assuming that, you normally assign a percentage of about 5% per egg. So you would need, first of all, you need to be younger than 38 years old,
Okay.
so that you will be assigned a 5% chance of pregnancy per egg. So you need about 20 eggs frozen before age 38 to have around 100% chance of having one child.
I see. Okay, so importante again yung age.
Yes.
And you want to freeze at least 20 eggs.
Yes.
I see. My last question, Doc, is how come I noticed a lot of the doctors like you who are fertility experts na who are all the way up there, mataas ang posisyon, are men. I think it's quite interesting.
I don't know. I don't like to imagine why. Well, there are a few very good women fertility doctors as well.
Yes, but I mean, I guess I was thinking lang na, was it so back in the day na parang hindi masyadong uso for women to pursue fertility, or parang nagkataon lang siguro?
I guess during my time, the guys who were really set on pursuing advanced fertility were really determined as compared to the women. Remember that when we started out, there were some issues about advanced treatment, so the men were more determined than the women. I'm not sure.
I see. Well, thank you very much.
Okay.